We're going to be looking at deep cuts in the Medicare and Medicaid program sometime soon. On Monday, the President is going to be submitting his budget to Congress, and he's going to include at least $70 billion, it sounds like, in cuts to the Medicare and Medicaid programs, as well as other cuts to the state children's health insurance program. These are the programs that care for your grandmother, the kids next door, the family down the street with a disabled child, and is what enables them to get the health care they need to do well in school, to come visit you at Christmas, and to be normal members of our society. The President is proposing these cuts even though we already have a health care crisis in the United States, and that's that 47 million Americans don't have health insurance. So they live knowing that a single serious illness is going to put their family into bankruptcy and that they can't get the regular preventive care that they need to stay healthy in the first place. He's doing this in part because we are all concerned about how much money the federal government spends on health care, and particularly through these programs. But he's treating the symptom, not the disease. The disease is that health care costs are exploding out of control. These are health care programs, and they pay for health care services, and they're as vulnerable to spiraling health care costs as your private health insurance is too. He's not doing anything, he hasn't proposed anything to deal with rising health care costs, and instead he keeps trotting out his ideas that would end up with people paying more but getting less, and those are his health savings accounts. Finally, I think one of the things people need to keep in mind is that the President is proposing these cuts now because early in his presidency he didn't make responsible choices. So now lower income seniors, kids who need preventive care and immunizations, they're the ones who are going to be paying the price for the fact that he didn't manage the surplus, and we now can't pay for important things like immunizations and checkups and the health care that people with disabilities and seniors need.